Thorax. True ribs. Types of ribs. True ribs, false ribs. True ribs. Vertebrosternal ribs. They attach to the vertebra posteriorly and sternum anteriorly. Ribs 1, 2, 3, 4, 5, 6, 7. False ribs. They do not attach to the sternum bone. Vertebrochondral ribs. Ribs 8, 9, 10. They attach to the vertebra posteriorly and costal cartilage of 7th rib anteriorly. Floating ribs versus vertebral ribs. Ribs 11, 12. They have no anterior attachment. They only attach to the vertebra posteriorly. Vertebrochondral ribs. Ribs 8, 9, 10. They attach to the vertebra posteriorly and costal cartilage of 7th rib anteriorly. Floating ribs versus or vertebral ribs. Ribs 11, 12. They have no anterior attachment. They attach to vertebra posteriorly. Typical ribs. Ribs 3, 4, 5, 6, 7, 8, 9. Atypical ribs. Ribs 1, 2, 10, 11, 12. Synovial joints. Ribs 2, 3, 4, 5, 6, 7, 8, 9. They are required for free movements and breathing movements. Fibrous joint. Rib 10. Fibrocartilaginous joint. Rib 1. Manubriosternal joint. It is symphysis joint. Xiphisternal joint. It is synchondrosis joint. Synchondrosis is greater than symphysis. Typical ribs. Ribs 3, 4, 5, 6, 7, 8, 9. Atypical ribs 1, 2, 10, 11, 12. Synovial joints. Ribs 2, 3, 4, 5, 6, 7, 8, 9. Fibrous joint. Rib 10. Fibrocartilaginous joint. Rib 1. Manubriosternal joint. It is a symphysial joint. Xiphisternal joint. It is synchondrosis joint. Fetal veins. Vital line veins, umbilical veins, cardinal veins. Vital line veins. They drain the yolk sac. They contribute to form portal venous circulation. Umbilical veins. They drain the yolk sac. After the removal of placenta after birth, umbilical vessels degenerate. Cardinal veins. They drain the body wall. Anterior cardinal vein. It drains the venous blood of body above the diaphragm. Posterior cardinal vein. It drains the venous blood of body below the diaphragm. All these veins, vital line veins, umbilical veins, cardinal veins, drain into venous end of heart tube. Sinus venosus. Sinus venosus to truncus arteriosus, then to aortic sac, then to aortic arches, then to two dorsals of aorta. Aortic arches in the head and neck region latter contribute to form the carotid artery, subclavian artery, arch of aorta, pulmonary artery. Sinus venosus, anterior cardinal vein. It drains the body above the diaphragm. Right anterior cardinal vein. Latter contributes to form the SVC. Left anterior cardinal vein regresses. Anterior cardinal vein. It drains the body above the diaphragm. Right anterior cardinal vein. Latter contributes to form SVC. Left anterior cardinal vein regresses. Posterior cardinal vein. It drains the body below the diaphragm. Right posterior cardinal vein. Latter contributes to form IVC. Left posterior cardinal vein regresses. Anterior and posterior cardinal veins on either side join to form right and left common cardinal veins. 3 veins, each draining into right and left horn of sinus venosus. Common cardinal vein, umbilical vein, vital line vein. Umbilical veins are coming from the placenta. Later in the fetal circulation, right umbilical vein regresses and only the left umbilical vein is left. Persisting left umbilical vein in the fetal circulation also degenerates and forms ligamentum teres of liver, having no function at all. Vital line veins drain the yolk sac, which forms gut tube. Right and left vital line veins are passing through septum transversum. Septum transversum breaks the vital line veins into right and left hepatocardiac channels. Right hepatocardiac channel later contributes to form terminal part of inferior vena cava, which carries the blood from